Brenda Jones Harden is the Allison Richmond Professor of Children and Families at the University of Maryland School of Social Work, and she directs the Prevention and Early Adversity Research Laboratory, where she and her research team focus on preventing maltreatments and other forms of trauma. She has conducted numerous evaluations of such programs, including parenting interventions, early education, early care, home visiting, infant mental health. And Dr. Jones Harden also has consulted with and provide training to numerous organizations regarding effective programs such as home visiting and infant mental health. She's a scientist practitioner who uses her research to improve the quality of effectiveness in child and family services and to inform child and family policy. I'm very lucky to have got to know Brenda from my graduate training at University of Maryland when she was there as a professor. And one thing I've always noted is Brenda is is highly respected in academic circles and is able to talk with such clarity in terms of with other those in research and evaluation, but also really understands and based on her experiences as a practitioner, how evaluation and measurement affects communities, affects practitioners, particularly those families of color and those who face adversity. So I'm very pleased to introduce Brenda. I think she brings an amazing perspective to close out our webinar today. Her title of her presentation is Equitable, Ethical and Effective Use of Measurement in Early Childhood Research. Thank you, Brenda. I'll let you take it away from here.
Thanks, Tyson. And actually, I was going to say how proud I am of Tyson. I'm getting long in the teeth, as they say. So it is so nice to see the people that I've known in their graduate training grow up and do bigger and better things. So it is just so much fun for me to see Tyson doing this. But the other thing I want to say, I'm really happy to be on this important panel, and so many of my friends and colleagues like Joan, Portia, and Neoma, all of whom I've worked with for a very long time, are on this panel. And because we think alike and we walk in the same circles, you're going to hear a lot of overlap actually between what I say and what they've said today, because we all learn from each other. So I'm so glad to be a part of this. So go ahead to the next slide. So I wanted to start with sort of thinking about the why early childhood measurement is so important. And as Tyson said, I'm coming to you as a person who lives in the research world now, but really views research as important for practice and policy. So for me, if it doesn't inform practice and policy, it isn't really important. So obviously, one of the first things I want to say to the practitioners here is, different from when I first started, now you have to have some kind of measurement of your work to prove that it is effective. I mean, this was not happening when I first started my career. And even the funders are now on the effectiveness bandwagon and want to think about evidence-based practice and things like that. So it's great what Phil and his colleagues are doing out in Oregon, because this is critical for any kind of good policy and practice work. But the other thing that I think is really important, and again, this is different from when I first started as a practitioner, we use data in a different way. And it helps us not only to understand whether our programs are effective, but also how we can make the changes midstream. So what we can do about continuous improvement. And one of my favorite projects is one in which we only collect data that's used for continuous improvement of programs. So I think that's critical. So you're thinking about it not just at the end, but sort of in a formative evaluation way, where you're thinking about how can we tweak programs, how can we change our strategies as we learn whether or not they're being effective in the short term. The other thing clearly is that we want to think as hard as we can about the outcomes of the little kids whom we're working with. And, I want to move us beyond just thinking about their learning and their academic outcomes, to think about, I'm going to channel my advisor, Ed Ziegler, who was one of the architects of Head Start, who always said you have to think about the whole child. You have to think about the child's health. You have to think about the child's mental health. And certainly for young children, we know how integrated those developmental domains are. So we have to really make sure that we're doing this. And we have to think about it, as many of the panelists have said earlier, not just sort of what happens with children in general, sort of using the basic kind of developmental knowledge we have about middle class children, but we have to think about what it means for specific target groups and even within your program. So instead of comparing children to a national norm, for example, to see whether your program is effective, comparing children to the children within your community, comparing children who are within certain classrooms to see if they're doing better than other children in classrooms. It tells you a lot about children's experience and that bidirectionality of what they're getting in the context of a classroom and what they bring to their own development. So really not just looking at, okay, 100 is a mean score on a child development measure, and if children don't reach 100, they're not growing. Really thinking about what happens over time with these kids, but also how they look compared to other children in their community. And clearly, we want to examine things through an equity lens. And I have to say, you know, in research, they teach us to control for race and to control for income. But probably the better strategy is for us to disaggregate the data to see whether there's a difference for children in terms of their outcomes of particular interventions. And one of the ones I like to always bring up is the early Head Start data that suggested it really looked like it had a huge impact on Black children. Certainly, we can't say that it's better for Black children than it is for other children. But what was interesting was when the group disaggregated the data and looked at white children versus Latino children versus African American children, you saw some very different impacts. So certainly disaggregating the data to be able to ask those kinds of questions. Okay, next slide. The other thing that I wanted to talk about in terms of the importance of EC measurement is really thinking about the contextual factors. And I know Portia talked to you all a lot about this, particularly in terms of parents and family, but I want to argue that we want to even stretch it a little farther and think about what the impact of neighborhood and community are. One of the former panelists was talking a little bit about child welfare and home visiting. And one of the things that we're discovering about poverty, for example, and about child welfare is that impacts for children really do vary by community in terms of things like what the concentration of poverty is, what's the concentration of a particular cultural group, what are the sort of supports and services in a community and how those impact kid and family outcomes. So really trying to think in terms of larger context as well. Also, things like structural racism, income, and race ethnic inequities are certainly important to think about in terms of this. And if I could say a word about income, we always measure income in all of our studies, but I'll tell you the truth, it gives us very little. What we find, one thing is that families don't even know really how much income they make. And oftentimes, you know, they might be a poor family living in a multi-generational household where when they combine all of their income, they're in a very different place. So we argue for looking more at parents' perception, like food insecurity and nowadays utility insecurity and all those kinds of things, as a way to help us understand these inequities and not just sort of leaning on the same data that we have for a long time in this field. But the other thing in terms of racism, and I'll talk about this a little later, is to think about perceptions of families in terms of experiences of discrimination. And we have started adding the everyday discrimination scale. It's not my scale, I'm not advertising it necessarily, but we've started adding it to all of our studies. And amazingly, we're finding, I mean, it's not amazingly, of course we'd expect it, but we haven't been including it until the last few years, that it predicts a lot. It predicts a lot in terms of parent functioning, but also in terms of parents' capacity to care for their children. And then obviously for us in the early childhood community, this kind of measurement gives us a standard for examining quality in early childhood programs. And I'm going to talk about that a little more, but I will just say here that again, thinking about this from the lens of social justice is something that's really important and things that we haven't really paid as much attention to. For example, the inequities among staff. We know that a lot of the caregivers in early childhood programs are women of color. We know that they experience a lot of trauma. We know that they don't have a lot of wealth. We know that nowadays we see high rates of depression in them. We're starting to ask these kind of well-being questions that certainly have impact for on the practices that they engage in. So really thinking about their functioning and how the inequities in society, which allow for people who are working in these programs not to have the kind of supports from the society at large and from their programs, how this does impact on practice. Okay, next slide. So I wanted to think a little bit. This is where I'm getting a little on the research side. And I heard Tyson say something about we don't want to talk about psychometrics, but I'm going to talk about psychometrics just a little. But I wanted to think about types of measurement a little bit as we think about working with community-based programs in early childhood. I mean, I am a fan of observational measures. Obviously, I was trained as a developmentalist. This is the approach that we often have in this field, but I will say that we have a long way to go. And I heard somebody mention something about attachment measures before, and certainly one of the criticisms of the attachment observational world is that we kind of think about attachment to one person instead of multiple caregivers that children in minority groups might be experiencing. So to some extent, we're not really learning what we could be learning about things like those core developmental processes like attachment. But I am a person who advocates for these kind of observational measures. I want to push us, though, more toward looking at naturalistic kinds of ethnographic observations instead of limiting ourselves to the structured and semi-structured ones that we do, because they do have limitations for our understanding of what happens in certain groups. If you think about it, the structured and semi-structured observational assessments grew out of somebody spending hours and hours doing that kind of naturalistic observation within certain communities. And I certainly think, we have a long way to go to sort of think about what might be more appropriate for certain target groups. So we might need to do that naturalistic work more. And I have to say a word about our coding approaches. I am a person who started graduate school coding parent-child interactions. I remember being in New Haven, and there was an unusual um, tornado in New Haven when I was there, and I had been sitting in a dark room coding parent-child interactions for 12 hours and went outside and saw trees on the ground and said, what happened? So I believe in coding. I was trained as a coder. Again, I will say that there are many times when I look at coding schemes and say, this does not really seem appropriate for certain groups. And I'll mention one thing, the intrusiveness. Any of you who've done parent-child interaction will remember that intrusiveness variable. I had an experience one time where I had two postdocs um, doing coding on parent-child interaction. And one of the things we look for is, right, reliability between the two coders, making sure they're, in the same vein on all the variables. And they were like within a point of each other. I mean, just so close in terms of how they view all the interactions between the parents, with the exception of intrusiveness. They were so far apart on intrusiveness. And the truth is, one was a Black woman, and she tended to not see intrusiveness as often as my white postdoc. They both were really smart, very competent women, but had a very different perspective on intrusiveness. So this is the kind of thing to me that suggests that we need to look a little more carefully at our coding approaches. Obviously, I'm a person who's going to suggest that we need to use multimodal methods, multi methods when we do these kinds of things. A lot of times we'll learn from qualitative work what we didn't get from quantitative because the parents just hurrying through trying to fill out the form, etc. And certainly I want to argue for using qualitative methods as a way to inform what we do on the quantitative side. So using focus groups for feasibility, one, what makes sense in terms of quantitative measurement, but also the process itself. Like in focus groups, you can learn whether parents are going to be willing to do a 30, 60, 90-minute phone call in this virtual world, etc. So I'm just arguing for taking some planning time in the beginning, doing some qualitative work, trying to figure out what makes sense for your real evaluation or real study. Now, again, I'm a developmentalist. I'm going to certainly argue for direct assessment. I do think it's important to do that in a formative and a summative way. In other words, as I mentioned to you, I really believe in using data for continuous improvement. So that formative piece is really critical to have in any kind of early childhood program. But we do want to know in the end, does this work? And again, sometimes that's not just an evidence-based program. It might be an evidence-informed program that we don't yet have the evidence for, but we know might work within a certain cultural group as well. Now, I'm going to say a word about physiologic research. I will tell you, I was a big naysayer of physiologic research with early childhood programs. I thought it was too much of a burden. I thought that families would be against it. I am finding that they are surprisingly willing to do this. Now, the one thing we haven't done, which I will argue against probably till the day I die, is doing hair cortisol with Black families, given what hair means culturally in Black families. But certainly, is as you see in this case, we have started collecting saliva. And I never thought, as an African American researcher, I would even buy into that. But one of the things, and I mentioned this on a call with Phil and Joan and some other colleagues last night, actually, that we're finding that often our parents are reporting low levels of distress, low levels of depression. But when you look closer at the physiologic underpinnings of their behavior, you find that they really do have high rates of stress. So now I've become a believer in thinking about these kind of physiologic kinds of measures. And now that I am a believer, I've started to think about how we can do it in a better way. And we really use that whole relationship issue that Portia was just talking about to convince our families that it's okay. And I'm telling you, we get like 90% of our families agreeing to it. I mean, we do things like show them videos, we show them pictures, we bring out the stuff beforehand, we do the feasibility stuff, all the things that I mentioned. But I will say, unlike I thought, you can get this done in low income and minority communities. Document review, important obviously for any early childhood program. And then the last thing I just want to say is really thinking about expanding our measurement toolbox to think about some culturally specific kinds of things. For example, I've been really impressed by people like D. Bigfoot and other people around the country who are doing amazing work with Native American populations, using cultural artifacts from that particular Native American tribe or something like that. So using things like Native American talking circles, best kind of focus group in the world, to kind of learn about, how a community thinks and feels. But the other example I wanted to bring up, I have a colleague in the School of Public Health at the University of Maryland who is doing amazing intervention and research work in the African American community. And he has had this whole emphasis on using barbershops to not only educate men about health. He's a public health person, so he's doing COVID work and he's doing all this amazing work on hypertension and prostate disease and all these kinds of things that are at high rates in African American male communities. But he's using the barbershop as a place to collect data as well, sort of using the kind of talk that goes on and doing verbatim reports of what the talk is about COVID or about prostate disease or about hypertension, and using that to document the perceptions of African American males. So just thinking about ways that are more akin to cultural norms and processes that might give us much richer data than our little questionnaires that people just, kind of go through and just fill in whatever they can to get us out their house. Okay, go on to the next slide. I do want to say a little bit about what I think is important for measurement to be like. Obviously, one of the things we have to think hard about, and I say this to our community partners all the time, is what do you want to know? What do you want to know? If you want to know how a child looks compared to, the national norms, that's one question. If you want to know about growth in your kids, that's another question. If you want to know whether the work that you've done with families results in child outcomes, that's another question. And what we try to help them think about is their theory of change, which is something we talk about a lot in evaluation research. What's the program's theory of change? What do you want to accomplish? And then to try and make the measurement help you to address that question. So that takes some thinking and some time. So I just wanted to put that out there. Is the data useful for continuous improvement? As I've mentioned, we want to make sure that we're doing these kind of formative assessments that allow programs to make a shift, like they've talked often about this rapid cycle stuff. I mean, it doesn't have to even be that fancy, but it could be, okay, this isn't working. Can we change midstream? And to be honest, oftentimes our standardized measures don't really help us answer those kinds of questions. So we might have to dig a little bit deeper and adapt some questions or use a different kind of modality. Obviously, we want to think about, can we use these measures over time? From the evaluation perspective, you need to do a pre-post or nobody's going to pay any attention to you, right? So you have to think about that. But obviously also, if you're thinking about young children, you want to look at their development over time. And I'll be honest, one of the biggest mistakes in a project that I worked on, actually two, wasn't mine itself, but one of these big projects, was where they used a measure for kids up to 2. They were trying to follow kids to 5, and they had to change measurement. So that has lots of implications for what you can say about development over time, but it also has implications for you being able to say whether your intervention works. So really thinking very carefully about, does this help us create a story that will allow us to tell that an intervention worked and that kids grew over time? And then the other thing I'll say quickly is about really trying to understand not just one behavior, but behaviors in context. Like, one of the things that we know very well in developmental research is behavior problems do not look the same in different contexts. So children can look great at school and be, what's at home, or vice versa. So we have to really think about the context that really creates the situation that pulls for certain kinds of behaviors, and be able to look at that head on. And the other thing I'll say, is important for us to think about these relationships as well that go on. What happens between a caregiver and a child in the classroom tells us more about that kid's capacity to self-regulate than where he is on a behavior problem scale. So again, arguing for looking more in a more sophisticated way as how children respond to caregivers. That's the whole thing about little kids. They need scaffolding of a caregiver. So it helps us to learn a lot more, to think about it from a Vygotskian term, to think about how these children are responding to contextual issues instead of these kind of singular ways that we ask those kinds of questions. Okay, next slide. Um, I do want to, again, Tyson, I'm sorry, but I'm going to say a word about psychometrics. Obviously, we want them to be reliable so that you're telling the same story across people and time and across questions. And we want to make sure that they are valid. In other words, is what we learn a true representation of what we're supposed to be learning by the measurement tool that we're using? So, okay, we know that it's something that's been talked about ad infinitum, ad nauseum in developmental research, certainly. But the question we haven't asked as much is what the psychometrics are among under-researched, underrepresented groups. Now, there are some measures. For example, again, I'm not advocating any particular measure, but the preschool language scale, for example, has some items on it where you can consider African American vernacular, right? They're never used. They're never used. People don't talk about them. When you read a study, they just say PLS. You don't hear that they've included this kind of thing. That's the kind of thing that we could advocate for. You all were talking about language and African American children. There is that kind of measure that exists, but we don't use it very much. We don't use it very much. Similarly, you all were talking about Latina children. I mean, we have started using the ROWPVT, because we've been convinced by the dual language learning people that you should not be just assessing Spanish speaking children in Spanish, nor should you be just assessing them in English, because they're learning academic things, academic vocabulary in preschool, and they're talking to their mommies and daddies and grandmommies at home in Spanish. So you really need something that allows you to account for all those different things. So we've started using that in our studies with Latino children. So the point being that you need to understand whether the measures are reliable and valid among different populations, and whether they've been standardized among different populations, including whatever population you're working with, low-income families in general, and whether they're part of the measures have been used with specific cultural groups. Now, one other thing I will say about this issue with target population, you need to make sure that the measures are feasible with a population in terms of how long it takes to administer, right? We've had a lot of children that just said to us, leave me alone. I'm done with this. I don't care. Close your PPVT box or whatever, right? So we have to really look at feasibility, which again argues for some good pilot work, not only in terms of time, but language that it's in. You know, does it make sense, again, to do Spanish speaking children just in Spanish or just in English, or should you do a combination? The format of the measure, the setting, the ease of administration, and obviously all that has important implications, not just for the population whom you're assessing, but what kind of agency you're in. To ask somebody who works in a childcare program to be able to do all this kind of stuff. And we're trying to think about it in the era of COVID, when we can't get into some of our centers, what's reasonable for us to ask a childcare provider to do, or an early childhood teacher to do, to help us get some of these data, right? We have to think about all these things. And the other thing that we're starting to increasingly think about is, can we have these measures vetted by the community? So in a new project we're doing where we're looking at perinatal processes, we have created a community advisory board that not only has, you know, researchers and people from these big agencies, but a lot of people from these small community-based agencies and organizations, and we are running the measures by them. Now, again, we have a certain knowledge base as researchers. We can't throw the baby out with the bathwater, but we are saying to them, do you think this question will work? Particularly if we're a little worried about the question. Do you think physiologic data collection will work? So they are really vetting for us some of the measurement strategies that we're trying to use. And I would certainly argue for that. Okay, next slide. I also think it's important to think about who you have measuring. And if anybody knows me, knows that that's a picture of me sitting on the floor trying to show my infant development undergraduate students how to do a Bailey of a very young child. Who happens to be a Latino child of an RA, actually. So certainly thinking about who your measurer is and are they representative of the population. Okay, next slide, and then I'm gonna close. So there are a lot of challenges for us. Certainly many of those have been mentioned before: virtual data collection, high stakes use of measurement, testing bias, all those kinds of things which have been mentioned. Next slide. And others like our limited repertoire of measures for family, which Portia talked about, the feasibility and affordability issue, and of course, as I've mentioned, the inadequate examination of these social and racial justice issues like implicit bias, inequities, and perceptions of discrimination. So these are challenges. And I'll close by making some recommendations. Next slide. So my recommendations are, one, that we try to engage in community engaged research and measurement development, where we have folks in the community much more involved in the decision making we have about methods as well as particular measures. We try to really think about continuous improvement as an essential part of what we are doing as researchers. We're trying to come up with measurements to create proof points. And I'll tell you, I took this from my colleague who's running our Educare program with whom we work. Programs want to know how we can help them with measures that'll show others, stakeholders, the value of what they do. Obviously, we got to think about virtual approaches to measurement, which we're doing now. We're giving the PPVT over Zoom. And thinking about broader examination of child outcomes, particularly beyond behavior problems self-report. And final slide, next final slide, thinking about standardizing measures on target populations, thinking about expansion of center, family, and home-based quality measures, because we have a lot to do in terms of that. Aligning quality measures with whatever curricula we're using, whether it's in home visiting or in center-based programming, and then the use of a social justice lens, not only for our questions, but measure creation, standardization, and implementation. So with that, I'll close. If there's any time for questions, I'm able to answer some.
Thank you, Brenda, so much. We really appreciate your talk. And I am glad you talked about psychometrics a little bit there, especially in relation to the community in which you're collecting the information on. We've definitely found that in our review of measures, something that some measures have done a good job, but for the majority that hasn't been considered within the validation of the measure itself.